What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're covering how important are your X-ray notes from a legal perspective. So to give you context, I'm a night shift X-ray tech. I've been doing it for 4 years, work a lot of overtime, and here I am giving you the knowledge you will know where. Find it out on the internet, on the YouTubes. I am here giving you the exclusive, very specific details of every niche aspect of the X-ray career, because there's a bunch of videos on nurses and any other medical field, but I feel the X-ray one is very, very to none. So, the infamous notes. So, technically speaking, the best way I could put it, as my professor did, one day, God forbid, you get called into court in the legal system that is our world, of the medical world. Because let's say the patient, will use the infamous John Doe, or let's say it's a lady, says she was pregnant and you shot her, and she's blaming you because you did not shield the patient, and now her child has deformity or has some issues that the doctor said that could be done because she got X-ray when she was pregnant, right? Let's just hypothetical here. Now, because legal stuff takes really long and it takes loops and stuff, it could be 5 years, it could be 10 years. There's been texts that said they've heard stuff from 15 years ago. Imagine, we run it. It's like 2025. I mean, some right now it is 2025, but imagine you started your career in like early 2000s and it's like 2025 and you're getting summoned to court because they're like, hey, Miguel, so-and-so said you didn't shield someone, hypothetically. And then you're like, they pull up the chart, they pull up the report. The only thing, unless you remember vividly this patient and this X-ray, which is pretty hard to do unless you have photographic memory or something crazy. The only way most people will be able to recall something is if that patient did something, or that patient was so messed up, like the X-ray or some like ungodly thing, that is one of the things that vividly sticks in your head. Majority of the time, you probably won't remember. It'll just be a basic chest X-ray, and they're like, you did it. The patient said you didn't shield, they'll whoop it out, and all you have is the image and your little notes you did that day. So the first thing you're probably gonna look at, and you're gonna be like, okay, did Miguel document that this patient was pregnant? Okay, he did. Okay, good for Miguel. Okay, did he legally document that this patient was shielded? He did. 2 checks off for you. You're doing very good. On the picture, does it show shielding? That's something my teacher said. If someone's pregnant, make sure that there is at least some form of the beautiful white lead, which that shows up that the patient was shielded. There is. You're on a good case. You're already doing good. Your lawyer's probably like, we're doing good. Probably won't get in trouble. Check. So you're off on a good basis. Because imagine, my teacher's like, imagine that you failed to document all this stuff. It's gonna be your word versus their word. And majority of the times, the patient's probably gonna win because, let's say that they got deformity, they got some sort of cancer, they got something that shows that could be happened because you did the X-ray. And it has your little timestamp, your little marker, your little thing. So the only thing you have to protect you is your little notes. Which I know from a day-to-day perspective now, working in the field, the majority of the time, a lot of the texts, you'll just be like CP, SOB, patient refused, patient da-da-da. Like simple basic notes. Which is fine for every walkie day patients, but I would say if you're given a chance and it's something that you think that will hypothetically Miguel in the future, or you in the future, get in trouble for, or it could be whooped out in court, take the time and put a little bit extra notes to keep you and your career safe. So yeah, it's been your boy Miguel. See you on the next one.